Hi guys, welcome back to my channel. It is Sam Kelly here, and today we are talking about what it was like being a respiratory therapist during the COVID pandemic. Also, just so you guys know, I'm wearing the Medelita women's scrub top in the color black, the Soulless style, and I'm just loving this neckline. It is so cute. I just wanted to mention that on here in case you guys are curious. A lot of the scrubs I wear are Medelita. I always leave what I'm wearing down below in the description box so you can easily find it too. I am affiliated with their brand because I love their scrubs. So if you do shop with the link that I leave below, I do get a small commission off of that to help support my channel. So as some of you know, I've been a respiratory therapist for the past 3 years. I recently left the profession to now pursue PA school to become a physician assistant. But I was working in the hospital as a respiratory therapist before and while COVID started, and then up until recently, which was July 20th. So though I'm not still working in the pandemic, I definitely was working in my state's peak of the pandemic. I'd like to give a little shout out to my cousin Gina, who gave me the idea for this video, and I'm so glad that she gave it to me because I think it's really important for you guys who are respiratory therapists or other healthcare professionals to really know what it was like as a respiratory therapist to go through and be treating patients with COVID. All right, let's get on with the video and let me tell you what it was like being an RT during the COVID pandemic. So first, let me just say COVID didn't hit my hospital till the middle of March, but before then, COVID was happening and kind of was on, I would say, all healthcare professionals' radars. It was something we heard about, but I'll be honest, at first, I didn't think it was going to be as big as it was. I didn't think there was going to be as many deaths as there were, and I didn't think it would spread that fast to my hospital. You know, you try and be positive and think that it'll stop or we'll find out how to treat it before it gets to you, but it did. It came to us and it spread fast. We knew we were going to get the first COVID patient no matter what. So that was a little scary, anticipating the arrival of our first COVID patient and just not really knowing what to expect. Yes, you read stuff online, but there wasn't a lot about treatments, or the treatments were experimental because this virus was new and we didn't know much about it, even as healthcare professionals. So of course, every day there's new research coming out of how you're supposed to treat COVID patients, but it just didn't feel real yet because we weren't specifically treating COVID patients yet. So in the middle of March, on one of my shifts where I was in the medical ICU, we were then trained on proper PPE that we would use for our COVID patients. We were trained on donning and doffing, which is properly putting on the PPE and taking off the PPE to limit the spread of the virus. So when we learned how to put on our PPE, we also learned what the appropriate PPE for a COVID patient was. That was to wear an N95, get out airborne sized particles, which are really small sized particles, a surgical mask over it to protect the integrity of that mask. The surgical mask either had to have a shield or we wore a separate shield over and down. And then we had on our blue gowns and then one pair of gloves. I know it kind of varied widely what PPE different hospitals were using, but that is what my hospital did. We were strictly following the CDC guidelines at that time. That's when it's kind of started to get real, but not really yet because we didn't have a patient. But I was like, whoa, this is kind of serious. There's proper procedures to put on and take off our PPE. They're really worried about the spread of this and how easily transferable it is. Then that very same day that we learned how to put on and off our PPE for a potential COVID patient, we got our first rule out COVID patient, and it was my patient. How lucky am I? So this was a rule out patient. So during this time in the middle of March, we didn't have rapid tests yet. So I think it took about 8 to 10 days to get that patient's test back. So at the time, what you do when you have a rule out or a suspected COVID patient, you treat them like they are COVID positive. The patient came up, it was in my room. I put on all the PPE. Luckily, the patient was already in comfortable vent settings because our ED respiratory therapist did a great job getting them situated on that. I did have to go in to draw an ABG on the patient just to make sure what we were doing on the ventilator was working for them ventilation wise and making sure they were properly oxygenated. An ABG, which is an arterial blood gas, is a needle stick into the artery, usually the radial artery on the patient. It's a normal routine that we always do. I didn't feel uncomfortable going in and doing that. Yes, I was wearing all this extra PPE, but it didn't really, even though I had my first rule out patient, it still didn't feel real yet. This patient just felt like another patient that was intubated, and I just had on a little bit more PPE than I would have had on. So in the days after my first patient, the ICU started filling up. We would have 2, then 3, then 4 rule outs, and then, some would become positive and some wouldn't. But I would say about 2 weeks after we got that first rule out patient, our medical ICU started filling up. So our medical ICU is a 27 bed ICU, so it's pretty big. and that's just one ICU in our hospital. Since we were only taking care of COVID patients at that time, our other medical ICU patients that were not COVID positive but were here for other medical reasons were then moved down to our cardiovascular ICU to leave room for more COVID beds in our ICU. Well, those started filling up, so then COVID patients started going down to our CV ICU, and our CV ICU patients were then transferred to another ICU. It was kind of becoming a hot mess, and when my unit started filling up with more positive patients, that's when I kind of started to get overwhelmed. For some reason before that, it just didn't, of course the pandemic was real and COVID was real, but it didn't overwhelm me until this point. It just felt like so much was happening so fast. I felt like though my whole team was supportive, my medical ICU team, not just the respiratory therapists, but also the nurses and the doctors and the APPs, everyone was working so well together and was doing such a great job. But even though we were working together and this was becoming our new norm, it was still really scary. I felt like among the nation, there was just new information coming out about treatments every single day. And then after that 2-week mark, things were changing, our treatment plans were changing, and obviously for the better, but it was just frustrating because we had to keep changing our treatment plans because these COVID patients weren't responding like normal patients would to the therapy we were providing them. So traditional things like increasing the PEEP or oxygen that would help a patient's oxygenation normally was not helping a COVID patient's oxygenation. It was just so weird, and it was just so foreign to all of us. I at times felt like I didn't know what to do. Luckily, I had providers who were researching all the time and getting all the new treatment plans from across the nation, from hospitals and providers that were treating patients before us, but it just at one point became very overwhelming. Almost scary. And the reason why, as a respiratory therapist, it felt really scary was because we were one of the only people that were bedside. So we were trying to really limit patient exposure. So we would time for the bedside nurse and the respiratory therapist to go in and do care together. So instead of just going in individually when you get a moment to do care like you normally would with a patient, me and the nurse would have to coordinate to go in and do care together. The nurses were doing stuff that they needed to do with the patient while I was playing with the ventilator and making sure that everything was okay with that. Since I was the other person in there and I was dirty, I would be helping them with patient turns and things like that. So it really was a team effort, and it was so great being able to work together, but it was definitely really scary at times because I felt like it was just us and the nurse going in the room. And obviously the doctors would go in the room, but only when necessary. So we had to keep doing our routine checks, but the doctors were only going in for procedures that obviously only doctors could perform. And that was the same for the PAs and NPs that worked in our medical ICU. Advanced practice providers were only going in when necessary, for an emergency to assess the patient, if the patient was coding, if they had to do a procedure that they could only do and the respiratory therapist or nurse could not do. And then there was a lot of personnel that just wasn't allowed in the room at all. So really, I felt like a lot of the responsibility fell on myself and our profession. So another thing that made working during this pandemic really scary was that I felt like guidelines for PPE kept getting lesser and lesser and lesser, and it just got really scary at a point. At first, when we were taking care of COVID patients, we would wear the PPE I talked about in every single room, whether they were just on a nasal cannula, a ventilator, a high flow, a BiPAP, whatever. We would always wear the N95, the surgical mask, the eye shield, the gown, the gloves. And then it got lessened. Then it was just, okay, you're only wearing N95 for aerosol generating procedures, okay? That was the majority of the procedures I was taking care of in the ICU. So I was like, okay, I'm still wearing my N95 a lot. And then they kept lessening what was counting as a aerosol generating procedure. At first it was the BiPAP, the high flow, and the ventilator. Then they took ventilator off that list. They said it was a closed circuit. Then they took high flow off that list because they said the particles weren't small enough to be considered aerosol generating. And yes, there was research. They weren't just making these choices willy-nilly, but it wasn't research that we're used to seeing. It wasn't long-term research. This was a pandemic. This COVID was new. So it was very short-term research that they were going off of to lessen the PPE guidelines. And I personally think that this was mostly because we were on a nationwide shortage of PPE. Luckily, my hospital never lost any PPE. We always had appropriate PPE, but we were following the CDC guidelines, which I think were trying to save the N95s that were kind of running out. This is just my opinion. This is not affiliated with my hospital or what all respiratory therapists or healthcare providers think. This is just my personal opinion and how I felt in that moment. And I felt scared. I felt slightly uncomfortable. I felt like we were being thrown into the fire, but at the same time, I could understand why it was happening, if that makes sense. And I'll admit, there was a point where I wanted to quit, but I was just so overwhelmed at a point, and I just felt like nobody really understood what I was going through, and I just thought it would be so much easier to just like quit my job and just take an extra couple months before school and figure out how I'd make money and make it all work, because I was so close to being done when this all happened. And it definitely would have been easier to quit, no question about that. You know, I just felt like I can't see my family. I feel like I'm endangering my significant other that I live with. I can't see my grandma that I hadn't seen since Christmas at that point. Anyone who went through this pandemic, it just felt lonely, especially as a healthcare professional working with COVID patients. I felt like very isolated, if that makes sense. And nobody wants to feel that way. But even though our ICU just, kept getting busier and busier, and we kept getting more COVID patients, and I felt like luckily I had my team to rely on, and everyone made work very bearable, and we tried to always look at the upside, and there was so many companies sending us food and thank you letters, and that really helped through all of this, but it still was hard to go through. It eventually became our new norm to be working in an all COVID unit. That doesn't mean it got any easier. It was still hard. I think mentally it got a little bit easier, but we were still seeing a lot of deaths. We were still seeing a lot of people being affected by this virus. So I guess it became our new norm, and it was easier to go through our motions at our job because we were so used to the PPE, the donning, the doffing, the constant change of protocols and rules. And I think it was just because we all knew there's kind of no end in sight. So we just took it in stride and just went about our job and just supported each other through it. I would say for about like 2 months straight, our ICU was 100% COVID. Occasionally somebody would get ruled out of COVID and then move off our pod and a new COVID patient would come in, but it was mainly COVID for a while. And slowly, people started getting better. The cases in our state were getting better, and our ICU started to clear out. By the time I left in mid-July, we only had a few positive COVID patients in the ICU itself. We still have COVID patients on the lower acuity floors, but at the time that I left in mid-July, the numbers were clearly better. Our state personally was doing well. I know around that time, a lot of other states are spiking in their cases, and it was good to know that things were getting better, and it definitely got easier at work every single day. But I still remember how hard it was, and I think going through this experience is going to make me a better physician assistant in the future. I think just because, how I was saying, I wanted to quit at one point because it got so hard, I don't think that makes me weak. I fought through it and I kept going through it. I went to work every single day, took care of my COVID patients to the best of my ability. And anyone who's gone through taking care of COVID positive patients and worked through this pandemic, I just want to say thank you. Just to let you all know, if you don't work in healthcare, these healthcare heroes, yes, they are nurses and doctors, like all the ads and things are saying, but our healthcare heroes are also our respiratory therapists, are also our physical therapists, our environmental services, transporters, phlebotomists, our CNAs and PCTs, of course, our advanced practice providers, which are our physician assistants. So a lot of those professions get easily forgotten through this pandemic and healthcare heroes movement, but it takes a team. It is not just nurses and doctors. There are so many people involved in treating all these COVID patients. So I just wanted to say thank you and give a shout out to all those other healthcare workers that worked through this pandemic and work together to help treat our nation. And I would also like to dedicate this video to the healthcare workers that have lost their lives while fighting on the front lines in this pandemic. Alright guys, and that is it for today's video. I am sorry that kind of got dark and sad there for a bit, but that is the reality of being a healthcare professional in the COVID pandemic and treating COVID positive patients. Being a respiratory therapist, COVID patients are very close to home for us. That was a big part of my job for the last 4 months of working as a respiratory therapist. I hope this video gave you insight to not only the job of a respiratory therapist, but what it was like working in the pandemic. And I hope it, gives you a bit of appreciation for those other healthcare professionals that were working so closely with COVID positive patients. I would like to give a shout out to everyone who is still fighting in this pandemic and still working, even though I am taking a step back from healthcare to now go back to school and further my education. I will soon, in 2 years, be a PA and hope that I can still help fighting this virus. I can help with future pandemics and just keep on helping taking care of our nation. So like I said, that is it for today's video. Thank you so much for watching, and thank you to those who keep coming back and watching more. And those of you who are new, if you liked what you saw, please subscribe, leave me a comment, like this video. Those things really help my channel, and if you like this video, it lets me know what you guys like to see and I can keep doing more of these types of videos. Alright guys, till next time, bye!